right, so I jump in on the chat rooms on Getter and Rumble and different places and say, hey, how's everybody doing? Tom Maga wrote something here. Steve, we're not being fooled by gas prices being lowered by the Biden administration. You might not be, Tom. But unfortunately, low information voters are. They don't understand the Strategic Petroleum Reserve is supposed to be there for times of emergency, cataclysmic events, hurricanes, war, natural disaster, whatever it might be, right? That's what the Strategic Petroleum Reserve is there for, and yet they're taking it out to save money. And by the way, driving your car, I'm going to get to the hospitals here in a second, but driving your car, very expensive, right? You know that. Auto repairs, good Lord. The average age of a car on American roads is now 10 years or more. They look a lot better than they did when I was a kid. Man, when I was growing up, old cars, you know, there'd be chunks of them falling off because they're so rusted out. Of course, that's back when we had the suicide window in the back, and they just set the kids back there and let them suck the the exhaust fumes for the whole ride. Hey, kids, what's wrong? Nothing, man. It's cool. Woo! Yeah, because you got the back window cracked. You got that suicide seat facing backwards in those big old Oldsmobile boats, General Motors boats. You know what I'm talking about. The window went down anyhow. Auto insurance rates, it affected you too, didn't it, Johnny? That's what's wrong with you. It was riding in the back seat of the car. I see you right there. You've never been right since, pal. Let's see. Auto insurance. And neither of you, Anthony, and you didn't even ride in that seat. Anyhow, 22% the increase of auto insurance premiums this year. A new report published by Insurify, whatever that is, it's an insurance comparison shopping site apparently. The average rate for full coverage auto insurance, $2,329. Yikes. $2,329 in the first half of 24, a 15% increase from 23, a 48% increase compared to 2021 when Joe Biden took office. 48% increase. Here it is, folks. Insurify. Bidenomics. What a joy. Kamalanomics. What a joy. And 700 hospitals closing, right? 700 hospitals closing. Over 30% of all such providers in the country at risk of closing their doors today. I've told you this before. I did a documentary on this. In fact, if you'd like to see it, remember this, flatlinefilm.com. It's a documentary I did in conjunction with the Epic Times. Flatlinefilm.com. You can go watch it in your spare time, something I did. It was released November of last year. A couple million people have watched this documentary. I go to places like Ducktown, Tennessee, and different places and look at these hospitals that have closed. The outlook even more dire for some rural facilities, 360 at immediate risk of closing within a couple of years because of financial problems. They have financial problems, inadequate payments from private health plans that don't cover the higher costs of care in rural communities, according to the report. But here's the real problem, and they'll try to blame insurance. That's one of the problems. The real problem is government reimbursement. That's one of the big problems. Government reimbursement. You see, 25 years ago, the government would reimburse, and usually within about 30 days, and the rates were reasonable. When I was in Ducktown, Tennessee, right, and the Copper Country Medical Center had closed, Copper Basin Medical Center had closed, the reason was if somebody walked through the door, an indigent person, unemployed, uninsured person, walked through the door, the reimbursement rate for that appearance at the emergency room was $15. The mayor of Ducktown told me, you can't pay a nurse for 15 minutes for $15. True. All right, fair enough. So the facility went bankrupt. But that's just one of the culprits. But you have the government, 25 or 30 years ago, you'd have a reimbursement rate that was pretty decent. Now it's lower, the amount you get paid, and it's much slower. It takes 9, 10 months, maybe a year. They have whole departments at hospitals. The entire department is dedicated to go through the paperwork to get the money that has been promised by the United States government. So instead of having nurses and doctors and attendants and people cleaning the hospital, you have an entire department dedicated to trying to get the money back for Medicaid or Medicare or whatever it might be, where money has been promised by the government and it's not there. Plus, by law, you have to take that person who's indigent. You can't turn them away at the emergency room, and so that becomes the primary health care because doctors are gone too. So there's one problem. Another problem is the insurance companies, as you know. Denied, denied, denied. Rates go up. Affordable Care Act. Was the Affordable Care Act ever about affordability? No, of course not. And, of course, there's also consolidation. Consolidation of, a big company will come in, they'll buy a group of hospitals, and they'll say, well, this one will keep this one. We're going to close these two. These people will drive to go get medical care, but they won't. They won't, and here's why. You got to go get a test today, Bob. All right, well, it's an hour to the nearest hospital now, and I don't feel like going. And, I don't want to take a day off of work, so they don't get tested. And then bad things happen. They get cancer, they get diabetes, they get whatever it might be. They get some malady that goes untreated because it's undetected. So their outcomes are bad, right? Plus, if there's an accident, a car wreck, and you need an emergency room, well, guess what? You're too far from that, too. Right? And so what happens if you have a heart attack, you're in a car wreck? Well, do the math. If you're not close enough to an ER, it doesn't turn out well. Quick comment from my friends at Hillsdale College. You can now watch an inspiring portrayal of Thomas Jefferson as he reflects on the meaning of the Declaration of Independence in a letter he wrote late in his life. Watch this special short video at gruberforhillsdale.com. Ever since it was founded in 1844, Hillsdale has remained true to its mission of offering the kind of education needed to preserve the blessings of liberty, the blessings that can be traced to the principles of the Declaration signed July the 4th. At a time when the far left rejects the principles of liberty and equality, we have to remind ourselves and our kids how great America is. That the Constitution is the greatest document ever created for human liberty and freedom. Gruberforhillsdale.com. Look, they do great work. It's free. And you can get a free copy of the Declaration of Independence as well. Please go to gruberforhillsdale.com. We're almost done with this opportunity. Only a couple more days. Man, you got a few minutes. gruberforhillsdale.com. I'll be back.